Children's Defense Fund is actually a national nonprofit, nonpartisan organization. We were founded by Marian Wright Edelman, a well-known civil rights activist who was the first black woman to be admitted to the Mississippi bar, and she also worked alongside Dr. Martin Luther King to found his Poor People's Campaign that he launched right before he was assassinated. And then a couple years later, she founded the Children's Defense Fund, and she's still our president and CEO, and really one of the most well-known advocates for children and families across the country. And we also have 8 state and regional offices, including Minnesota. So our national office out in DC lobbies on federal legislation, and our local state offices look at the needs in their particular communities and advocate for those. Of course, they're informed by our national priorities. And our mission is up here. It's kind of long and a bunch of starts, but basically we want to ensure that all children have what they need in childhood so that they have successful passage into adulthood. And we know that that will not only benefit the child and their family, but our community and country as a whole. And you'll see all the starts, and this year's data book is kind of formatted around our mission statement. So if you've opened it up, you'll see that there's sections on a healthy start, a head start, a fair start, a safe start, and a moral start. And that was just kind of a way for us to frame the data, because every year we do pick a theme and kind of go with that theme to make it easier to organize. And so in Minnesota, we do our work kind of in 4 areas. So first and foremost, CDF is a legislative advocacy organization. So we lobby on behalf of children and families at the state capitol. So when you think of lobbyists, you might think big oil or big business. We're the big kid at the Capitol. And we were really founded on access to health coverage and care for children in Minnesota. And we were instrumental in the creation of Minnesota Care, the expansion of that program, and some changes to medical assistance in Minnesota Care. And as you'll see in the data further along in the presentation, we've made tremendous gains in covering kids in Minnesota and across the country, as many of you likely know. And so we've since turned our attention to issues around economic stability for families, because we know income affects child outcomes. And if we can make small increases to income through work support programs or wage gains, we can affect all areas of child well-being. So we advocate for access to child care assistance. We were the co-chairs of the successful Raise the Wage campaign. We also look at issues around access to early childhood education. So we've advocated for scholarships, for school readiness, for really any kind of stream of early childhood funding, because we believe in kind of a multi-delivery system approach, because families have different needs, and so they may want to access different types of programs based on those needs. So those are the issue areas we focus on, but we also do a lot of different things and support a lot of different efforts at the Capitol, as well as, of course, play defense when there are proposals that we believe will harm children and families. And all of our policy priorities are really research and evidence-based. That's why we have our Kids Count project in addition to our advocacy, because we want data and research to inform what we do. We want to make effective investments that are proven to work for children and families. So the Kids Count project is actually a project of the National Annie Casey Foundation. So if you listen to NPR, you may hear little blurbs about the Annie Casey Foundation. And they're out in Baltimore, and they fund a lot of areas around children and families, but one of their projects is Kids Count. And that's they give a grant to an organization in each state, typically a child advocacy organization like CDF, to track data on child well-being to advance policies and programs that support child success. And so it's also a network of advocates and researchers who are focused on children and families, so we're able to learn from each other too. And so as part of that grant, each year we publish an annual Kids Count data book, and we go out and do our Kids Count coffees across the state. So this week I have been in Mankato, Red Wing, and Bemidji, and now here. Next week we'll be in Duluth. We're going to do a Kids Count at the Capitol for legislators and advocates. So we're doing multiple, right after the release of the data book, we go all over and tell people about the state level and local data. And then we do some issue research outside of that, and I'll talk about a couple of projects we're working on right now in a little bit. And then the closest we get to direct service is through our outreach and organizing work. So some of you may be familiar with our Bridge to Benefits project. It's a web-based screening tool we founded in 2007. The goal is to connect low-income working families to work support programs and tax credits. So as many of you know, the programs like SNAP, WIC, School Meal are all administered by different agencies, different application processes. It's really difficult for families to navigate all of those programs. And so we've put a screening tool in one place. They can enter their income, household size, determine what they're eligible for, and connect them to work support, those programs that can help them apply, as well as how they can end up enrolling. So it's been a really successful project. We screen more than 100,000 Minnesotans each year. The Department of Human Services recognizes it and uses it as their screening tool for their online application, and many counties refer to it as well. And so Patty's also going to mention how we've partnered with Hunger Solutions and just give you a little background on some of her work so you can have that as a resource.
Just briefly, we care about the same issues of kids growing up healthy, and we know that a hungry child cannot learn. So at Hunger Solutions, we have a helpline with live people answering calls for folks who need food assistance. We use the Bridge to Benefits tool to help figure out if they're eligible for other benefits too, but it's great for them to have a live voice, and we can refer them to, we can actually send out the application for SNAP benefits, find out where the nearest food closet is for them, farmers markets, and other sources of food for their family so they can be healthy, the kids can have enough to eat so they can pay attention in school and learn. So today we've brought some materials for you to pick up with the helpline number on. If you work with parents or clients, this is a great resource for them. And again, the two gals who answer the phone are really very personable and really helpful to people. So we're here too if you have any questions afterwards, myself and Nicole. Thank you.
Yeah, and we do a lot of referrals around the state to Hunger Solutions, and we work together in many ways. It's nice that we're neighbors. Our offices are next door to each other by the Capitol. So we also have, and I should mention with Bridge to Benefits, we provide free training and we partner with organizations and schools. And so if you're interested in that, we'd be happy to come out and do a training on how to use the site and connect families to work support programs and tax credits. Voices and Choices for Children is a newer initiative at Children's Defense Fund. It's a cross-sector coalition of leaders of color and early childhood advocates of color, including parents, to build power within communities and bring that power to the Capitol to advocate for issues around child well-being for our youngest Minnesotans. And that was founded by our former executive director, Peggy Flanagan, who's now State Representative Peggy Flanagan. She represents St. Louis Park area, and Melvin Carter, who's the director of the Children's Cabinet. And they found that they were often the only people of color at many tables around decision-making tables for young children. And so they wanted to bring together more people and build power within communities to advocate for programs and policies that benefit children of color in particular. And so we staff the coalition. The coalition makes up their own legislative priorities. And this session, they're bringing an array of priorities, including one bill that just got introduced that's a community solutions fund for healthy child development that would provide grant funding to organizations run by and for children of color to implement kind of their own solutions to access to early childhood intervention and education. So that network is also always growing, so if you're interested, let me know and I can connect you to Daniel Yang, our organizer. And then we do some youth leadership programs. Some of you, especially the people in the Osseo schools, may know about our Freedom School program. Freedom School is a summer and after school enrichment program that has culturally based curriculum, and the goal is to help children fall in love with learning and reading. And it was really a vision of Mrs. Edelman, and it's come to fruition tremendously, particularly in recent years. We are only in 8 state offices, but we have Freedom Schools in about 30 states in the country and serving thousands of students. In Minnesota, we have about a dozen sites serving 1,200 students and 2 full year-round programs, and the rest are summer programs. And there's a couple programs in the Osseo School District, and the rest are in Minneapolis and St. Paul. And the curriculum was created primarily for Black and African American children originally, but in Minnesota, we have been the first state to adapt the curriculum for Hispanic or Latino children. We have a program at Academia Cesar Chavez in St. Paul, and then for American Indian children as well. And so it's a really dynamic, effective program. And Children's Defense Fund provides the curriculum and kind of oversees the training and implementation, but actual school districts, churches, community organizations implement the program. So it's a really great model and partnership. And then we do some training with young adult leaders, and we have a scholarship program called Beat the Odds for young high school seniors who've overcome tremendous obstacles to go on to college. And it's our annual fundraiser too. We have some invitations here. It's on March 30th at St. Thomas if you're interested. It's a really inspiring evening hearing from those young people. And just want to point to the data center where the data we'll talk about today, and more data is available at the national, state, and local level. We update the Minnesota page, and you can create maps and trend lines, compare indicators. A lot of people and nonprofits use it for grant reports or other kind of community needs assessments, and we of course use it to support our policy priorities. But anytime you need help navigating, it's pretty easy to use, but sometimes it can get a little finicky. Feel free to reach out to me. I also do individual requests for data. So this year's data book theme is around early childhood generally. So I want to make sure it's not just about early education, but all kind of developmental aspects of early childhood. And we wanted to really add to the conversation around what children need in their youngest years. Because what we've found, and what you likely know, is generally across the country in Minnesota, we've all pretty much come to agree that early childhood is an important time in a person's life. And it's an important time of development. And supporting that development can mean positive outcomes long term. So regardless of political party or geographic where you're from, you probably understand that. Now where the difference lies is how do we promote success in young children? And there's been great debate about that at our state capitol, at the national level. And so we wanted to bring together the research and data on all of that and kind of outline it so that people could be informed in that conversation. So that's what the introduction summarizes, that research and data. And then we have sections on how environment affects development, early ed affects development, health coverage and care, and then safe and nurturing environments affect development. And then the last section, A Moral Start, has quotes from community leaders, cross-sector business owners, religious leaders, early childhood educators on why it's important to invest in young children, in their opinion. And then we focus 4 programs, we call them Tipping the Scales programs, that are working across the state to improve outcomes for children, young children and their families. So we always try to highlight organizations, and many of those we learn about in Kids Count Coffees. So, and then of course we have our state level data tables at the end that are organized around 8 themes, and you'll see it'll say CT next to the indicator if it's available at the county level online. And we also, of course, do our county level fact sheets, which is just our selection of county level indicators. So I hope you have some of those. I will talk about some metro area data as I talk about the state level data as well. And another thing, Children's Defense Fund and the NEKC Foundation in recent years in particular has really paid attention to disaggregating data by race and ethnicity. If you were at the coffee last year, you'll remember that was the focus of our entire data book, was looking at opportunities for children of color and American Indian children in our state. And so you'll see most of the data I'll present on today is disaggregated by race and ethnicity. And I just want to make a note of some of the limitations of that. So there's 5 racial and ethnic categories that most data is collected by. So white, black, Hispanic or Latino, American Indian, and 2 or more races. Some people, it's tough for them to really fall in one of those categories, not to mention those populations are very diverse. So our black population encompasses families who've been here for generations and generations, as well as recent immigrants from Somalia or Ethiopia or many of the refugee countries we see in Minnesota. Same with the Asian population and Hispanic and Latino. So it's important to kind of recognize that while we are disaggregating data, there's fractions within each of those communities that have different needs too, and we hope to do a better job of disaggregating data in the future, but some of it has to do with data regulations and what should be published and what shouldn't be published based on sample sizes and population sizes. So we try to follow those rules, but sometimes we break them so we can publish the data. So you'll see that a couple of times for American Indian data in the data book. And we also think it's important to kind of understand some of the historical context that produces some of the disparities in our state in particular. So I'll talk about some of that as much as I can in this presentation, and we often reference those in our reports too. And one other thing too, the foundation releases a national data book each year in the summer, and they rank states on child well-being based on 16 indicators. And if you saw the news this summer on that report, Minnesota ranked #1 in child well-being for the second year in a row. And so of course we want to celebrate that. Minnesota does know what works in a lot of aspects to make children successful, and we've made significant investment in children and families in recent years, and that has propelled us to that #1 ranking. However, that's aggregate data. When we break it down by race and ethnicity, we see very different outcomes for populations of color in our state, and we make that clear when we talk about that report, as well as in our data. And it's not just disparities between white children in Minnesota and children of color, but there's disparities in how we're doing for children of color compared to those populations in other states. So I'll also talk about that a little bit too. So welcome everyone who come in. Feel free to get snacks and settle in. You haven't missed too much. So we start on page 6 looking at the demographics of Minnesota children. So there's about 1.3 million children in Minnesota, or about a quarter of our state population are children under 17, or 17 and under. That's what I mean by children whenever I say it. Young children under age 5 make up 27% of the total child population in Minnesota. And we look at where the young children live. This chart shows the percent of the total population under age 5 by county, and you'll see it ranges from 3% in the light gray to about 8% in the dark gray. Metro area counties have some of the highest rates of populations of young children. And you'll also notice one thing I see in this, some of our poorest counties in the state have the highest percentage of young children. So these counties up here, Mahnomen, Beltrami, Cass, have some of the highest rates of child poverty. So does Ramsey County. The metro area counties, as you'll see, have lower rates of poverty, but definitely have pockets of poverty. Counties like Hennepin, of course, are so diverse. I mean, it goes from Roger to Minneapolis to Edina, and so sometimes the indicators are skewed a little bit, but when you look at pockets in the community, there's more poverty and lower income. And when we look at data by race and ethnicity, we also need to recognize the significant growth in populations of color in Minnesota that's being driven by the diversifying child population. So in the past, since the turn of the century, we've seen large growths in those populations. So about 12% of the total child and adult population in 2000 were people of color and American Indian. 2014, it jumped to about 1 in 5 or 18%. And the state demographer estimates that by 2035, about a quarter of our total population will be people of color and American Indian. And actually, the assistant state demographer is the former Kids Count director at Children's Defense Fund. So I talked to her a lot, and she said all of their projections are being surpassed. So we'll likely reach that 25% mark before 2035. And Minnesota, many other states are already surpassed that mark. So Minnesota is still a fairly diverse state for the Midwest, but compared to many other states have a more diverse population. Already 50% of babies born in our country are babies of color or American Indian. And the child population is really driving this growth in Minnesota. Already 1/3 just about of all of our children are children of color and American Indian in the state. And when we look at that breakdown, what we see is, this is for all children 17 and under, we see that we're still primarily a white state. 71% of all children in Minnesota are white. And when we see the breakdown by race and ethnicity, 1% are American Indian, 6% are Asian, 8% are Black, 9% are Hispanic or Latino, and 5% are children of 2 or more races. What we know about the child population is it's actually been on the decline in Minnesota year after year slightly. So the white child population propels that decline, because actually all populations of color, with the exception of American Indian children, have been growing significantly over the course of several decades. And when you look at the 2000 census to the 2010 census, we're waiting for 2020 for the next census, but we saw 50% growth in the Asian child population over that time, 80% in the black child population, 100% or a doubling of the Hispanic or Latino population, and 50% growth in children of 2 or more races. And again, the white child population, American Indian child population, is on the decline. Some people may jump right to immigration and migration as the reason for that growth, and in Minnesota, of course, that's a piece of it. We're a state of many immigrants and refugees, for many of whom who've been here for a long time, and others who are still coming. However, the actual real driver of this growth is higher fertility rates among populations of color currently compared to the white population in Minnesota, and that's really kind of a national trend. When you look at this by young children, it's not much different. So under 5, it's 70% white and 9% black. That's the only difference. So they look pretty similar. And so, of course, before we get into kind of the data about early childhood development, I want to be able to summarize the research, which many of you are probably very familiar with, around the importance of early childhood development. A lot of the research on early childhood development came right out of Minnesota, out of Art Rolnick and the University of Minnesota. That's some of the top research in the country around what children need and how we can invest in them. Another good source of research is the Harvard Center for the Developing Child, and they really do a great job of kind of breaking it down for a lay person, someone who isn't an early childhood person generally. And so that's where a lot of this information comes from. But I'm going to, try and do all of that work justice and summarize it in about 5 minutes. So I'll do my best. And many of you, of course, are well versed on this too. But significant brain development, some estimates say about 90% of brain development or brain weight is formed in the first years of life. And there's many more new neurons being created in a child's brain compared to brains of adults. For young children, it's 700 neurons per second that are being created. And when you're a parent or an early childhood educator, or you interact with a young child, you can almost see those neurons sparking as they're learning and exploring. And I get the pleasure of doing that with my 2-year-old son every day, and it's just phenomenal. I mean, I think of a couple months ago what he was doing compared to what he's saying and doing now, and it's really incredible. And of course, brains are built from the bottom up, so simple skills create the foundation for advanced skills later on, which is pretty, common sense statement. But I also want to point to, of course, it's the academic skills, so we don't learn to add and subtract, or we don't learn to multiply and divide before we learn to add and subtract. But it's also socio-emotional learning skills. Those are really important to be developed and honed in early childhood, so a child is ready to learn. More and more research is showing that importance. So those are things like executive functioning skills, self-regulation, emotional control, social interactions, kind of the stuff that makes you able to sit in a chair and listen to a teacher and be kind to your classmates and be able to have the attention span to focus on schoolwork. And so those are really important, and honing in those social emotional needs in early childhood are part of those skills in combination with academic skills. And of course, a child's genes that they're born with or the experience they're born in has an influence on how they turn out, but it's not the only thing. Their experiences, positive or negative, also kind of put them on their path and their journey. And when children's experiences are more adverse, that can result in toxic stress that actually damages the developing brain. So this is the ACEs part of the research, adverse childhood experiences. So those include things like poverty, hunger, homelessness, exposure to violence, lack of nurturing caregivers. And when one or more of those events happen in a child's life, just like any of us, if we experience a stressful situation, we're going to get clammy hands or stomach aches or have really physical and emotional responses to those experiences. Same with young children. And what ends up happening, the research shows, is their brains actually are damaged. And you can see it on the brain scans of children who've had adverse experiences compared to children who've grown up in more harmful environments. And of course, that exposure to toxic stress can lead to lifelong problems. So thankfully, the research doesn't end there. That's not even actually the point of the research. The real point of the research is that not only can we prevent those adverse experiences, but we can repair any damage that has been done by those experiences and put a child back on a trajectory to success through stable, caring relationships and caregivers, through programs like many of those that you all run, family home visiting, ECFE, early education programs, just any program with a focus on stable, caring relationships, as well as economic stability. And so what a lot of the Harvard research talked about was how resilience is developed. And that's part of overcoming these obstacles and repairing that damage, of course. And there's a general belief in America of the bootstrap mentality, that somehow you have to have your own little bootstrap and you have to pull yourself up by it. However, the research shows that that is not how resilience is developed. Resilience is developed through stable, caring relationships and encouragement. And you all who provide that for many children can see that happening. And through our Beat the Odds scholarships, no one of those students come alone. There's an army behind them that have lifted them up and supported them and helped them develop resilience. And the research backs that. So I don't want this to be, this kind of is key to the research and the crux of the importance of investing in early education, intervention, and prevention. So the title of the data book is Tipping the Scales. So how do we tip the scales for children who their scale was kind of off balance to begin with? And so I like it because it's a good metaphor for children because you can think of it as a teeter-totter, right? So the fulcrum here could be genes and experiences, and depending on the combination of those, positive or negative, the scale may be tipped in either directions, tipped toward successful outcomes or tipped toward the potential for negative outcomes. So when children have those adverse experiences I mentioned, it leaves them hanging and tips their scales on a trajectory toward more negative outcomes. However, we can pile on early education, intervention, and prevention through work support programs, healthcare, nurturing caregivers, and supportive communities to not only improve their outcomes, but develop resilience for kind of long-term success and overcoming those obstacles. And so that's the kind of tipping the scales metaphor. And with those early education and intervention programs, it's important to recognize that parents come in families, and parents' needs are based on the fact that they have children. So that's kind of the whole idea of the two-generation approach we talk a lot about in the data book. And two-gen approach is really kind of a buzzword right now. Everybody's talking about it and figuring out how to integrate it into their programs. But really it's common sense. It's the idea of supporting healthy child development while caring for the parents' needs, including economic stability, empowering positive parenting, and enhancing their support networks. And so some kind of tenets of a good two-gen program is one that supports economic stability, the positive parenting, provides easy access to services, so puts things all in one place, provides transportation, childcare, integrating early childhood services, and then providing all in the context of a family's culture and needs. Sounds easy, right? But one shining example of this, of course, is Head Start. Head Start is really first and foremost a school readiness early childhood program, but they incorporate parental involvement. They have the kids brushing their teeth, and they provide early childhood screening and referrals to programs. So that's kind of a model for two-generation approach. And so when we look at some of the programs that young children participate in, this is on, I think, page 6 or 7. It might be kind of hard to see. We wanted to kind of look at access for children of color and American Indian children, as well as what underfunding of programs does to participation. So the first three programs we talk a lot about in our data book and really at the Children's Defense Fund generally are the Child Care Assistance Program, which is really a work support program. You do have to be working and meet the income requirements, but it provides a subsidy for lower income parents to afford child care. Head Start, I already kind of talked about, but the income eligibility is below poverty, and 3 and 4-year-olds are the focus, but there is early Head Start too. And then the Early Learning Scholarships kind of has two funding streams. One is more of kind of a voucher program. A family can take that and use it at a high quality rated provider, rated through the Parent Aware system, or some of the money also is funneled directly to early education programs to support enrollment and other initiatives. It's not always to open up seats or provide more spots in a classroom. So all three of these programs are severely underfunded. Not all eligible children can participate. Of those that do participate, we see about 60% are children of color, American Indian, and about 40% are white. And that, really that balance is a good thing because children of color are more likely to be lower income in our state, as you'll see, as well as, addressing needs in early childhood can improve academic outcomes and reduce disparities as well. But what we see in the Child Care Assistance Program in particular are, lower rates of participation for Asian Pacific Islander, American Indian, and Hispanic or Latino. So there's some outreach and enrollment needs in those communities. And the other thing about child care assistance, with the high rates of children of color participating, particularly black children, is it's a work program. So you do have to work. And one thing we know about black families in particular, as well as other families of color, is they work lower wage jobs. And so these programs are supporting that work and making sure that they can provide for their children. And kind of addressing some of the economic disparity we see in Minnesota. Head Start has a little bit different makeup of the children of color. They do serve many more Hispanic or Latino children and a few more American Indian children. The scholarships in 2015 didn't have data by race and ethnicity. The 2016 data looks a lot like Head Start. Now, medical assistance and WIC, medical assistance, of course, free healthcare program, WIC, a food voucher program for pregnant and breastfeeding women, as well as children under age 5. These programs are unique in that they're fully funded. So you apply, you're found eligible. This is where most of our at-risk and high-need children are. So what we recommend doing is looking at participation and the children in these programs. How do we get these kids into these and other district programs or other early intervention programs? And you'll see the breakdown by race and ethnicity is actually fairly similar to the other programs. And very high, 173,000 in MA. Actually, 45% of babies are born on medical assistance in our state. A third of all children are covered by medical assistance. They have much higher income requirements too, about 275% of the poverty guidelines. So in Dakota County, they did a project where they wanted to connect WIC families to school district programs. So what they did is they sat down with the WIC families in one of the school districts, had them sign a release form to send their contact information to the school district. So the school district could then follow up with the family, tell them about preschool, ECFE, ECSE, screening, etc. And so what they found is 80% of all the parents who filled out that form were not known to the district, so they had never received any communication. And of those 80%, 89% enrolled in a district early childhood program. So again, there's kind of some innovative ways we need to look at working cross-sector with these programs to make sure that enrollment in these programs are getting closer to this. And of course, more funding is a piece of that, is a huge piece of it. So talking about kind of cross-sector, cross-agency data, some of you may have heard of a new initiative by the Department of Ed called the Early Childhood Longitudinal Data System, or eSLEDS. There's a K-12 system called SLEDS. But what this does is it's a data tool. It's online. You can go visit it. It's public, eclds.mn.gov. It combines and links data from the Minnesota Departments of Health, Human Services, and Education to show children's growth and development in relation to their participation in a variety of programs. So for instance, what this site does is the Minnesota Family Investment Program, or our cash assistance program, is run by the Department of Human Services, where a lot of the ed programs are run by the Department of Ed. So we used to not be able to know how many MFIP kids were in preschool, how many MFIP kids are on WIC. So this tool integrates all of that so you can see how many MFIP kids are enrolled in ECSE or ECFE or district preschool and the child care programs on the site. Not every program, of course, is on there. They're working on it, but it's a really neat tool. And we are actually using some of the data to produce a report in a few weeks that looks at MFIP access to early childhood programs for MFIP families, as well as some access for children of color. So we'll be sending that report out to all of our Kids Count Coffee participants when we publish it. And there is some ECLDS data in the data book too. So the Fair Start section looks at how environment affects development, and of course one of the biggest indicators of outcomes is family income. So this is on page 10 and 11. So this chart looks at levels of poverty by race and ethnicity and by age. So of course the poverty threshold is $24,230 a year for a family of 4 with 2 children and 2 parents. We all know that is nowhere near the cost of basic needs for a family of that size. In fact, we estimate it takes about $55,000 a year to meet a bare bones basic needs budget. So about twice and then some of the federal poverty threshold. So that's why we also look at low income families, about $48,000 a year, because poverty really isn't a good measure of economic stability. All children in Minnesota, 6% live in extreme poverty, below $12,000 a year. 15% in 2014 lived in poverty. That was about 189,000 Minnesota children. We do have one of the lowest child poverty rates in the country. Nationally, it's over 20%. And when we look at the trend in child poverty, we just saw from 2014 to 2015 the first statistically significant decrease in child poverty since the recession in 2007. From 2007 to 2012, we saw 70% growth in child poverty. And really, the first decrease wasn't that big. We're still at 14.5%. So what we know is the economic recovery has not reached low-income families in our state, and that's a trend across the country. About 34% live in low-income households. When you look at young children, it's just a little bit more in each category because young children are more likely to live in low-income households. When we break it down by race and ethnicity, we start to really see the economic disparities for children of color in our state. 9% of white children, that's actually, I think, the 3rd lowest child poverty rate for white children in the country. When you look at Asian children, we're often the highest rate of child poverty in the country is for Asian children at 19%. Of course, our Asian child population is a little different than other states, but still alarming that we're often the highest rate. For Hispanic or Latino children, we're kind of middle of the pack at 30% of children living in poverty. Black children at 45%, we're ranked like 25th or 26th compared to other states. So again, it's not just a disparity between children of color and white children, it's actually a disparity in our outcomes compared to other states. American Indian children at 28%, not all states have a large American Indian population, so I think just under 30 are produced statistics on poverty, and we're still in the, I think, ranked 6 out of those states. So some of the highest rates of poverty for children of color and American Indian. And then when you look at low income, we still see those disparities in really high rates of children of color and American Indian children living in low income households. And when we look at the metro area numbers, what we see is, kind of the outer ring metro area counties have very low rates of child poverty. Washington and Scott have some of the lowest in the state. They also have the highest median incomes. Hennepin, 17.1%, but definitely this area is a pocket of higher poverty rates, as well as Minneapolis. But again, because of the expansiveness of Hennepin County, you see kind of a lower aggregate number with those pockets. Ramsey has one of the higher rates of child poverty in the state at 24%, and then of course comparing to the statewide at 15%. And another indicator of income and success are children living in areas of concentrated poverty. So this is areas where 30% or more of all residents are below the poverty line. And what the research shows is that children living in these neighborhoods, regardless of their own household income, have worse outcomes due to lack of resources in that neighborhood, lack of healthy fruits and vegetables to be purchased, lack of health providers. Oftentimes the property taxes are lower, so the funding for the school is lower. So it's just compounding effects in these neighborhoods. And the really alarming thing is that in the past decade, we've seen a doubling of children living in these neighborhoods, and it's a majority of children of color and American Indian children who live in these neighborhoods. And a lot of the research is pointing to this being a significant contributor to the academic achievement gap. So not the end-all be-all, but it's those compounding effects of lack of resources in a community that results in a child walking in the door and having difficulty meeting all of our academic standards because of outside factors, as well as low funding in those communities. And when you look at the numbers for Black and American Indian children, 13 times the rate of white children. So our community in Minnesota is becoming more and more income segregated as well as racially segregated. And American Indian children, 3/4 of them live in greater Minnesota. So this isn't only a metro or urban issue, it's an issue in greater Minnesota too, because high rates of American Indian children live in these communities. And another important program to look at when talking about low-income children is the Minnesota Family Investment Program. I already mentioned once. The program's goal is to improve economic stability for families with children and get parents to work. And it tracks a lot on the parents, what they're doing, looking for work, finding work, and working, but it doesn't pay much attention to the child outcomes. But these children are at significant risk because they're forced to live in below extreme poverty with a monthly cash grant of $532 maximum for a family of 3. In the metro area, the fair market rent is about $1,030 a month, so twice this. So these are some master budgeters, and the actual cash grant has not changed since 1986, 31 years. So we've really left these families further behind, and it's putting their children at significant risk for development. And I will talk, one of our policy priorities is raising the cash grant, so I'll talk about that. 71% of all people accessing MFIP are children. That's something people don't understand. Most people, a significant majority of people accessing the program are children. And not all children in poverty access the program. In fact, we find only 1 out of every 3 child in poverty is accessing MFIP in Minnesota. And we look at that by county. We have higher rates in the metro area, but greater Minnesota, some counties are as low as 6% children in poverty enrolled in the program. And we know that's because the program has a lot of onerous paperwork and barriers for family for, you know, a $532 benefit that doesn't even get them close to meeting their rent. So there's a lot of barriers with participation. And this really is an early childhood program. It's never really talked about in that way, but we know it is because 68% of all MFIP households have a child under age 6, and 1/4 have an infant. So this program is really should be doing better in supporting and tracking child development, and we have a lot of recommendations around that. And of course, small increases in family income have proven to improve outcomes. So when we raise that cash grant by $100 as has been proposed, the research actually shows that just as little as $1,000 in annual income in early childhood can improve academic test scores later on. So when we increase income, we improve outcomes like our 4th grade reading level, which you'll see many of our children of color and 80% of our low-income children are not meeting those proficiency standards in Minnesota based on the standards we've created. And we do have some of the highest rates of, for overall, of reading proficiency in the country. When we break it down by race and ethnicity, that's a different story. We also know increasing income has long-term outcomes and cost savings for children into adulthood. It increases their years of school completed, annual earning and health outcomes, and decreases male arrests, non-marital births, and food support participation in adulthood. And that study just looked at increases from below poverty to 200% of poverty. So again, not, huge increases in income. So access to early ed is another indicator that, of course, drove the reason for focusing on early education. So this looks at young children age 3 and 4 not in school in 2014. The Census Bureau frames it as not in school. That's not necessarily how we think about early education, as being school in the same way K-12, but that's how the question is asked, and what it encompasses are school-based school readiness and preschool programs, centers that have curriculums, family child care providers that have curriculums. So it's pretty encompassing. Head Start is included. What we find is 55% of our 3 and 4-year-olds overall are not enrolled in school. And when we look at it by race and ethnicity and income, we see higher rates of those children not in school. We've made significant investment in early learning scholarships, school readiness programs, and the child care assistance program in recent years. Many of those, we need to the data needs to catch up. So we hope to see these numbers move in the right direction with that increased funding. But really, it's going to take significant investment to get these numbers down to where they need to be. Quite frankly, some kids are never going to participate in a traditional preschool or center-based program. Their parent maybe stays home with them, or they have grandma and grandpa. But we also need to find ways, if they're not going to be in one of those programs, to connect with those families through ECFE, screenings, other partnerships between centers and in-home providers. So there's been a lot of move in the right direction, but we got to see this number increase too. And it's going to take money, because lack of funding is what denies access for many children. 83% of income-eligible children are not receiving early learning scholarships. 52% of income-eligible children are not enrolled in Head Start. 94% are not enrolled in early Head Start. All these programs have wait lists and are underfunded, and that's the main reason for that. Child care assistance, 88% of income-eligible children 0 to 12 are not enrolled in that program. 84% of 0 to 5-year-olds that are income-eligible are not enrolled. We did an analysis on income-eligible and work-eligible too for child care assistance, and it's still in the 70 percentile for each of these age groups. So it's a huge lack of funding. There's 6,000 families on a wait list. More than half of those families are in Hennepin County. They wait 2.5 years to get on child care assistance sometimes. It's not only prevents the parent from working, but kids can't wait. That's actually the name of our coalition that's trying to increase funding to CCAP. But they can't wait, because if you're waiting 2.5 years, you're going to be in kindergarten pretty soon. So we need to increase funding to move those numbers in the right direction. And of course, high quality early ed impacts all aspects of development. A lot of the talk is around school readiness, but it's also been proven to improve health outcomes long term, to improve those executive functioning and social emotional learning skills, as well as some studies have even linked it to increased citizen engagement in adulthood. So if you were in early ed programs, you might be more likely to vote or be a leader in your community. So there's a lot of benefits for that individual child and us as a society. And of course, there's the research that also shows every $1 investment in early childhood programs that are high quality returns $16 in cost savings and return on investment later on. So, as individuals and as policymakers, we sometimes struggle to pay now and save later, for savings later, but we got to make that investment because it will mean better outcomes and long-term cost savings for us. I just want to pause real quick and just check if there's any questions or thoughts or comments so far. And I need a sip of coffee. So the Healthy Start section looks at health coverage and care for children in Minnesota. And this is one of the brightest spots for now in the research, is that we have significantly decreased the number of uninsured children in our state in recent years, particularly directly after the passage and implementation of the Affordable Care Act. So this looks at data on the number of uninsured children in Minnesota in 2009 and 2010 when the act was passed and implemented, compared to 2013 and 2014. Minnesota already had one of the lower rates of uninsurance across the country, but you'll see this is age 0 to 5 and this is 6 to 17, and I think this would be on page 12 or 13? 14. So this is the decline in the number. So significant decline in the number. Since the passage of the Affordable Care Act, we've seen almost a 60% decrease in the number of uninsured children in Minnesota. And we're at a historic low in uninsured children. In 2014, it was 4%. Right before the data book was released, they released the 2015 data. It was just over 3% uninsured children by the Census Bureau. The state does its own study, and it finds 2.7% uninsured children. So we're looking at just a few thousand, I think it's 39,000 children who are uninsured in our state. And that's all, a lot of it's been through enrollment in public programs like medical assistance. We, of course, are very concerned at the Children's Defense Fund about the discussion around repealing and replacing the Affordable Care Act at the federal level. And while there are things that could be improved about the Affordable Care Act, we definitely need to maintain or continue to improve covering our kids and providing access to preventative services and coverage for young adults up to 26 on their parents' plan, and ending lifetime limits, and making sure people with pre-existing conditions can get coverage. And so there's been some studies. The Urban Institute estimates that if the Affordable Care Act is completely repealed and we roll back to the federal Medicaid standards — Medicaid, of course, is medical assistance in Minnesota, which, I'll be honest, is highly unlikely, particularly in Minnesota, but still we never know what'll happen. 209,000 children would lose coverage, and our uninsured rate in Minnesota would go up to 18% uninsured children, a rate we've never seen basically since we've measured this. So we'd be moving significantly backward if we repeal without a replacement that maintains these gains. And when we look at uninsured children in the metro area, all counties are either at or below the state level. And one thing I find with this is in greater Minnesota, even in counties with high rates of poverty, there's higher rates of uninsured children. And I think it's really in the metro, we do a pretty good job of outreach and getting people on public programs is what I would say. It's always in the metro, we see higher rates of participation of people eligible. And we've pretty much eliminated disparities in coverage for Asian, Black, and 2 or more races, but where we really need to target outreach dollars are Hispanic or Latino children and American Indian children, who are uninsured at about 4 times the rate of white children. And of course, American Indian children have unique health insurance eligibility. Our treaties promise health coverage and care, and we're not fulfilling those treaties, obviously. And so we need targeted, culturally relevant outreach to those communities. And then this chart looks at infant outcomes by race and ethnicity and shows some of the disparities between prenatal care, low birth weight babies, and infant mortality in Minnesota. Just kind of showing that disparities start early. One that I'll talk about what the research shows is the low birth weight babies. Across the country and in Minnesota, we've seen the total percent of low birth weight babies increase in recent years. And of course, a low birth weight baby is at risk for physical and emotional and developmental delays, as well as they're at higher risk for infant mortality and other health concerns. And they're often very costly to the family because they stay in the hospital and all of that for much longer. And so the reason they're thinking that low birth weight babies have increased is because women are having babies later in life, which is one factor that increases the likelihood, as well as more babies of color are being born, and babies of color are more likely to be low birth weight. And when they've looked at the research, particularly around Black women and their newborns, they've found that it's a factor that contributes to the increased likelihood of low birth weight babies is actually stress that is caused by racism and structural barriers in society. So the children and babies, before they're even welcomed into this world, are feeling the impact of kind of the structural racism and issues we've created in society for them. And so it's definitely something we need to break down those barriers so that even before babies are born, they're not experiencing. So when we provide access to health coverage and care, the research shows we get better students. Expanded Medicaid in many states has proven to be linked with a decrease in dropout rates and increase in college attendance and bachelor's degrees. So that's another reason to support Medicaid expansion. That was a tenet of the Affordable Care Act. And another little data point we looked at was the disparity in asthma rates for children of color, particularly American Indian and Black children. And if you have asthma as a child, you're 50% more likely to miss a day or more of school. And so we know that if we can manage disease, reduce disparities in health outcomes, it'll help reduce the academic disparities. Again, not all of it, but another piece of that solution. And in the Safe Start section, we looked at a lot of child welfare data and around safe and nurturing environments. So I had never actually broken down child welfare data by age. So if any of you are familiar with this data, this may not be a surprise to you, but almost 40% of all reports of maltreatment are children 5 and under. And so it's 10%, more than 10% are reports for children under age 1, and it's about 6% for each of the other ages up to 5. And that's of all reports of maltreatment to counties and the state. And, oh, this is a little hard to see, sorry, but this is child protection indicators in a few counties in the metro area. So Hennepin County has a rate of 5.2 children abused or neglected, so that's substantiated cases of maltreatment per 1,000, and an out-of-home placement rate at 8.9. So the rate of abuse and neglect is a little higher than the statewide average. The out-of-home placement is a little lower. Out-of-home placement, of course, includes foster care, but it also includes juvenile detention and placements that happen when a child has like a severe disability and maybe has to live in a group home, so not really a purpose or a reason of abuse or neglect. But most of the children who are in out-of-home placement, it is because of substantiated case of abuse or neglect. This is Anoka County, Dakota County with some very low rates of abuse and neglect and out-of-home placements. Dakota County, low rate of abuse and neglect, high rate of out-of-home placement. We see that in some counties across the state. Ramsey, fairly average rate compared to state of abuse and neglect, and just a little bit higher rate of out-of-home placement. Oh, I think that was just a mistake. That must be Washington. Washington, yep. Because I know Dakota has the low rate of, yep, the higher out-of-home placement. And yeah, the out-of-home placement rate by county varies vastly. I was just in Beltrami yesterday. Their rate of out-of-home placement is 59.1 per 1,000 children. They do have a significantly higher American Indian population, and you'll see the rates of American Indian children in out-of-home placement are ludicrous in Minnesota. So some rates of out-of-home placement are as low as 5 per 1,000, and they can go up to that rate of 60. It really, and of course, county social services operate and determine who goes in out-of-home placement. And there's also been, there's been a couple, if you all probably followed, there was a couple really significant tragic cases of abuse and neglect that drew attention to some issues in our child protection system. That was a few years ago, and the governor created a child protection task force. Our former executive director sat on that task force when she was the ED of CDF. And there are a lot of changes made, and you'll see in the out-of-home placement rate, some of those changes did actually drive up out-of-home placement. And again, we can't think of out-of-home placement, of course, as always a bad thing. There are definitely cases where children need to be removed from the home, but that is a very traumatic experience for a child, of course, not to mention whatever the circumstances were around the abuse and neglect. So this looks at disparities in out-of-home placement. So down here are, this goes from 2005 to 2014. Down here are the rates for white, Hispanic, or Latino and Asian children, you know, hovering around 10 to 15 per 1,000, and really not much change over the course of the time. This is for children of 2 or more races, so you see a slight uptick, and right around this time was when we started making some of those changes to the child welfare system. Black children were on the decline, and then they saw an uptick after those changes. This line, the yellow line, which may be a little hard to see, is the anomaly, and it's American Indian children. You'll see a skyrocketing increase since we made some of those changes, and it's nearing 100 per 1,000. That's almost 10% of American Indian children in out-of-home placement in our state. There's a federal law that tries to protect children from not being removed from the home, because our country, of course, has a history of inappropriately removing Native children from their home. The Indian Child Welfare Act has some tenets that encourage tribes to be able to make the placements to be in culturally appropriate homes or within the tribe whenever possible. And there has been some great work around that, but still, this is just really shocking statistic. And when we look at the rates of disability among children in out-of-home placement, they're 10 times more likely than the general population to have a disability. Part of that piece is, that some children are in out-of-home placement because of a disability, but I just did a presentation at the Department of Human Services, and the child protection people there said that's really a pretty small, it adds to this, but it's a pretty small sector of the population. Most in out-of-home placement, again, are there for abuse and neglect. But of course, trauma has those adverse experiences and affects developmental delay. So that's the trauma that those children have experienced likely creates some of those disparities in disability among that population. So at Children's Defense Fund, for a long time, we've been advocating for expanding some access to Part C early intervention services, or basically early childhood special education. Part C is a section of the IDEA, the Individuals with Developmental, or Individuals, the Education Act for Children with Disabilities. And this provides intervention services to children aged 0 to 3 who are exhibiting a developmental delay or have a condition that provides them at a high risk of developmental delay. And so the law is actually pretty open to what states can define what that means. And some states have looked at the ACEs research and said children with adverse experiences should be categorically eligible for Part C intervention, because we know those adverse experiences put them at risk for a delay. So there's a few states that have made Part C automatically eligible for teen parents, for parents with maternal depression or other mental illnesses, even just poverty. Some have a list and say if you experience 3 of these, you are automatically eligible. Minnesota, we really haven't created Part C to be a program targeting those populations. And right now we do have direct referral to Part C from children in the child welfare system, which is great. But we have had a bill that's been introduced in legislature, I think for the past 3 legislative sessions, to make homeless children categorically eligible. With our work on that, the Department of Ed started tracking how many homeless kids were receiving Part C. The report had almost more pages than actual number of children who are homeless receiving Part C. 8 kids last year who were homeless received Part C intervention, and we estimate about 35 homeless infant and toddlers on any given night. So there's long been recognition of the disparity in access to Part C for children of color and low-income children. And so there's really an outreach issue. For instance, 10% of the 2015 kindergartners who were Black received Part C intervention services, whereas the actual rate of special ed in K-12 for Black children is somewhere near 17%. So there's a discrepancy in catching and intervening early for populations of color and low-income populations. And we think expanding Part C eligibility to include kids who face trauma could really improve outcomes. There are some barriers to that because of the school districts operate it, workforce issues, of course. So one thing that is trying to address that is our expanded Help Me Grow model and proposal. So Help Me Grow is the information and referral for Part C. And there's a sign right out there for Help Me Grow that you can kind of read and learn more about it. But basically, it tries to get people in to be screened for eligibility for Part C. But Help Me Grow, the Department of Ed is working to expand that in the Children's Cabinet so that not only would it just be screening for early intervention, but a family could come figure out a variety of resources for early education, intervention, economic stability through the Help Me Grow system. So it could really be, and the state it's in the governor's budget, and it was just heard, our executive director testified on it yesterday, but they're already moving forward with the work, even if it doesn't get funded. So we're hoping that that passes, because it would be a great way to connect young children to resources. And Part C is a really effective program. 1/3 of Part C participants did not need special ed by 3rd grade. And that's phenomenal considering the fact that many Part C participants are kids with significant developmental and physical concerns. So, concerns like Down syndrome and that special ed is almost a guarantee. So I just want to pause and see if there's any questions or thoughts before I quickly go over our legislative priorities.
When you say that's in the governor's budget, that last point, that's in the education budget, or is that in the Health and Human Services budget?
I believe it's in education, yeah, because it was heard in Representative Loon's committee yesterday. So, and it's because Part C is funded through the Department of Ed, as well as the Children's Cabinet is too, so they're a big, and I can't remember the fiscal note on the moment, but it's to develop the technology and create the grants, because it would actually be, Help Me Grow is funded through Department of Ed, but it's run in local communities, which is also a strength, because local communities, of course, know the resources, have connections to families, so could be a great model. Any other thoughts, questions? So there's our children for a good background, and I just, of course, some of this data is tough to swallow and see, but it's necessary to kind of figure out how to make improvements for child outcomes. And we have 4 legislative priorities this session. As I mentioned, we work in a variety of areas, but these are our top priorities. And I should pass around. We do have postcards if you'd like to support our priorities, and we'll give these to the governor. That's been our target, but you can also, of course, contact your legislator about them too. So first, we want to create a paid family and medical leave statewide insurance program. So we're the co-chairs of Minnesotans for Paid Family and Medical Leave Coalition. So this would create a statewide paid family medical leave insurance program that would guarantee all workers, a public and private sector, access to paid family and medical leave. And this would be budget neutral effectively. I think there's some very small startup costs, but it would be a 1% tax on employers and employees up to $78,000 of earned income. So the maximum an individual would pay is 1% of their income up to $78. And so there's been, the proposal has kind of varied. I think it's pretty much settled on 12 weeks for new parents, of both genders, as well as if you need to take time off to care for a sick loved one. And very few, a lot of families in Minnesota don't have access to paid leave through their employer, and you're less likely, if you're low income or a person of color, to have access to paid family leave through your employer. So this would offer it through this statewide program. Many other states have done it. The unique thing about our proposal is it would be a progressive payout, meaning lower income families would get a higher percentage of their income back. Because what we found in other states like California, who've had a program for a long time, is low-income families don't take advantage of it, because if you're getting 2/3 of a paycheck that still doesn't meet your basic needs, you're not going to be able, you won't be able to stop working and not getting the full paycheck. So our goal for that is so workers can care for themselves without jeopardizing family security. And then, of course, I've already mentioned we want to improve access to affordable, accessible childcare with a 2-generation approach of parents being able to work and provide for their family while children are in a stable environment. So we're proposing to fully fund the basic sliding fee child care assistance program so all eligible children can enroll, increase the reimbursement rates to child care providers for that program. Right now, the reimbursement rates are at the 25th percentile of the 2011 market rates. So not only are they, 6 years outdated, but they're at the 25th percentile of 2011, meaning 75% of providers in 2011 had higher rates than what the state reimburses. And then we want to improve the system with new federal standards. The Child Care and Development Block Grant, that's a federal grant, released new standards a couple years ago. We do, in order to implement those, which we have to do to receive the federal funding for this program, which comprises about 2/3 of the funding, we have to implement those, but it must go through the legislature for us to implement those, and we have to fund those implementation because it includes really great family-friendly provisions like 12-month authorization, so families don't have to do continuous paperwork, which is a burden on providers too, as well as some provisions for homeless families and a few other things that just improve access. But there is a cost to it, and if we don't fund it, we will, of course, see an increase to the wait list and fewer families being able to access it. I should mention this, didn't need to be in the governor's budget because it's budget neutral, but he has supported paid family leave, and you may have heard he expanded paid family leave for state workers. The governor's budget did include the funding for the family-friendly provisions of the block grant, as well as an increase to the Child Care Assistance Program reimbursement rates. He just updated the survey to the current market rate. So with his proposal, it would maintain that update. So each year we would use the current market rate survey, but stay at the 25th percentile. So not our specific proposal, but getting closer. But there wasn't any new funding to the program outside of those two provisions, just to fund more families, which is the other piece we're asking for. Yesterday in the House, we had, our bill was introduced to increase enrollment by 1,000 families, so fund 1,000 families and hold the number of families served harmless. The number of families served has decreased year after year because the program keeps getting more expensive. So this would hold the families harmless, increase funding each year, as well as serve 1,000 additional families. And it is a bipartisan bill. So we have, the lead author is a Republican, Patty Fitz. Fitz, is that the name? I'm trying to think of the last, Roz Peterson, sorry, Roz Peterson. Yeah, right, I'm like, wait a minute, that's, she was one who supported us in the past, yeah. Roz Peterson, so we have bipartisan support there. Paid family leave really has been a partisan issue with our proposal, but there's other proposals going around to address the issue of access to paid family leave. We don't think they're strong enough to serve particularly low-income families and families of color. So there's a lot of discussion around this, though, at the Capitol. The first increase to the Minnesota Family Investment Program cash grant that since 1986. This, for the first time in a few years, was not included in the governor's budget, so we were disappointed in that. However, we are still, working on a bipartisan proposal. We have bipartisan support in the House and the Senate for this increase. There's long been an effort to increase the MFIP cash grant, but it's always kind of lost its way toward the end of session. So we hope to see that increase. And we do work in coalition for a $100 increase. CDF has advocated for a more significant increase as well, but we work in coalition with that increase. And then we have proposals for targeted increases to the Child Independent Care Tax Credit to offset the cost of childcare, as well as the Working Family Credit, the state's version of the Earned Income Tax Credit. These were in the governor's budget last legislative session. Of course, increases to both tax credits were included in the tax bill that had an error in it that was made at the last minute, and the governor had to pocket veto it. He supported this. It was an unrelated error. So we do have high hopes for expansions to these tax credit, as well as bipartisan support. And I should say last session, paid family medical leave passed the Senate, didn't get a hearing in the House. Lots of talk around childcare, a creation of a legislative work group around accessible and affordable childcare, but no specific funding. The cash grant, had some progress, and then, like I said, petered out at the end of session, and that's where the tax credit landed. So those are our current priorities, and if those are something you support, we encourage you to take action, talk with your legislators about these priorities, follow us on Facebook, Twitter, get our email updates. We'll keep you posted on what's going on, as well as you can write a letter to the editor or other efforts to kind of reflect on the data and share more widely what's going on with children in Minnesota. So I think I finished just on time, but if there are any questions or thoughts, let me know. And if not, we can feel free to grab more treats and more data books. I have plenty, or county fact sheets. And I'm happy to take postcards as well and answer any individual questions. Yeah.
So Stephanie, first of all, thank you for your presentation. I would also add, for folks in the room, you're sitting in one of our early childhood spaces, obviously in the school district, but our school district has also benefited tremendously this year for the legislature passing the voluntary pre-K funding, which overall was $25 million. Osseo area schools received the largest allocation of those dollars, and that was based on free and reduced lunch rates. So in the 7-county suburban metro category, we had 8 of the top 50 highest free and reduced lunch sites, including 6 of the top 14 elementary schools that had the highest free and reduced lunch rates. In that category. So I know a lot of folks, and I'm preaching to the choir in this group, but Osseo area schools, we have some of the highest poverty rates in the state. Right here where you're sitting in Brooklyn Center, Brooklyn Park area. So of course we're supportive of Children's Defense Fund's lobbying efforts on where you mentioned, but we're also supportive of increases in school readiness dollars and also voluntary pre-K. So program access is important to us. Certainly we support the access to school-based programs, but we're also very supportive of CCAP and opportunities that allow families access to high-quality center and family child care providers. So I just wanted to add that in case.
Do you know how many new additional kids were served through those?
Yeah, so we're serving 266 4-year-olds through the voluntary pre-K program. Another note of interest perhaps to this group is 100 of those 266 kids are English language learners. So we didn't know who to anticipate who would access the voluntary pre-K. We received the funding on August 1st, and 266 of those kids started on September 7th.
Wow.
So this year we've already got 177 of the 266 slots filled. We opened up enrollment just this in January, so we're serving primarily students of color in this program, as well as the English language learners. So we're excited that a lot of 4-year-olds are going to be more likely to be ready for kindergarten next year. So.
Wow. And I will say we testified in support of the school readiness dollars. We testify in support of early learning scholarship. We're kind of unique in that we basically support all of those efforts because, like I mentioned at the beginning, we know families have different needs and different funding streams can fulfill those needs. But we just need more funding, and we need to also kind of streamline that funding and make it more effective, because a lot of these programs, they are layered on top of each other, and it can create confusion for families and providers. But more slots and more kids in programs is good. Yeah.
One thing some of the child care advocates have brought to the legislature is that a lack of child care centers and child care spots, especially in the outstate.
Yep.
Can that be tied to the CCAP numbers, or?
Yeah, I think, reimbursement rates have a piece of that, because when a provider isn't getting reimbursed enough, they often have to eat the cost, and so that has caused specific centers to close. I know the center at the Minnesota Indian Women's Resource Center, that's specifically why they said they had to close. That's in Minneapolis, however. I think in greater Minnesota, it's a combination of factors. I mean, New Horizons isn't going to go to, Watonwan County, because that's not a good market base for them. So we have to look at innovative ways. I think CCAP is a piece of it. It's also supporting family child care providers who do offer a lot of the care in greater Minnesota. So making it easier for them to get licensed to provide high quality education, as well as the reimbursement rate piece. But we do track data, and we have it in the back of the data book too, and in online, around providers that accept CCAP, what the rates are, so we look at some of that needs issue in the state. And there's some counties where there's literally one, at least that fills out the survey, one provider. So it's a huge barrier. It's not even affordability, it's just access. So it's definitely an issue that some of it can be solved through this, but it also is, how do we support providers to make it economically viable for them to open and stay open in those communities. And of course, the early education workforce is underpaid, and there's a lot of turnover because of that, and it's hard work, and it's work that is fueling our future, to be kind of corny, but it's true. So yeah, it is a big concern. And our coalition has a lot of different groups, so many of them are looking at that. Whereas it's not, our main issue has been funding CCAP, which is a piece of that, and the provider rates, but. Yeah.
You showed a chart earlier, and I think it was a chart that related to the percentage of uninsured, and the chart showed that the American Indian was had a very high number. Yep. And Hispanic Latino had a very high number, as I recall.
Yep.
And my question, you talked a little bit about the American Indian and what some of the factors might be there, but are there particular factors that might explain why Hispanic and Latino numbers are as high as they are?
And one thing I didn't mention with American Indian is that they can get health care through IHS, so sometimes they go uninsured because of that, but if they're uninsured, IHS doesn't get the reimbursement rate. It's a higher cost to them. Hispanic or Latino, this is the census, so it covers individuals of all immigration status. And so immigration status in Minnesota is a requirement of enrollment in medical assistance. So that's one of the factors. We have explored in our Voices and Choices for Children Coalition, it's part of, in their priorities, medical assistance for undocumented children. I know New York has passed this, so that it doesn't matter your immigration status. If you're a child, you can get medical assistance. It's something we're looking toward. Right now, there's bigger fights to fight, kind of, not to, prioritize everything. But the other factor that I've learned with our Bridge to Benefits work is not even, a lot of Hispanic and Latino families who are eligible for public programs, including medical assistance, have a fear of putting their name on a piece of paper. Because you can also be a parent and be undocumented. If your child's a U.S. citizen, you can apply for these programs. You do have to provide income verification, and the county cannot, actually, it's against the law for them to report any immigration issue. However, it's a fear of even documented Hispanic or Latinos to get on. There's a lot of misconceptions about the program. So that's something we're working to kind of reduce through Bridge to Benefits as well. And I also think it's our outreach. I mean, the face of Minsure was Paul Bunyan. Paul Bunyan doesn't speak Spanish or connect with other, racial and ethnic communities in my opinion, I should maybe say. So, I think we have to think about outreach in different ways for the communities too. So, any other thoughts? Appreciate the discussion. And like I said, grab some treats or coffee out the door and feel free to, I'll be here for a little bit too.